Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. It affects how you feel, think and behave and can lead to a variety of emotional and physical problems. Depression may require long-term treatment, but don't get discouraged. Most people with depression feel better with medication, psychotherapy or both. Although depression may occur only once during your life, people typically have multiple episodes. During these episodes, symptoms occur most of the day, nearly every day. The first symptom of depression is the feeling of sadness that lasts from morning to evening. It may not be related to any events or persons. A second symptom is a lack of interest in doing things that were enjoyed before. For example, reading newspaper, watching TV, talking with friends. Fatigue for no reason is the third symptom. For example, always feeling like lying down, lack of energy. Fourth symptom is lack of sleep. For example, a person always wakes up at least 2 hours early. He is constantly unable to complete his sleep. Lack of appetite is the fifth symptom. He can't even eat his favorite food. Sixth symptom is the slowness of thoughts and actions. For example, if someone is asked a question, he takes more time to answer it. Similarly, if he is asked to do something, he takes more time to do it. Lack of concentration is the seventh symptom. When a person tries to concentrate on any activity, many thoughts come in his mind like waves of the sea and change his thoughts. Eighth symptom is suicidal tendency. Depressive thoughts are the ninth symptoms. For example, one feels that there is no hope in his life, feeling that his life is not going to be okay the way it is, feeling that he is alone with no one to help him, feeling that he is a liability to his relatives, unreasonable guilt. If at least 5 of these 9 symptoms persist for 2 consecutive weeks, the person may be considered to have depression. Decreasing chemicals such as serotonin and norepinephrine in the brain are widely seen in people with depression. From young children to the elderly, depression can occur. It is estimated that 20% of women and 10% of men may experience depression at some point in their lives. Depression is a completely curable condition. But if this is not treated, it can lead to suicide. Untreated depression sometimes leads to suicide. According to the World Health Organization, depression is one of the most common and preventable causes of suicide. Let's think about how depression is treated. The proper treatment for this is medication to regulate the levels of these chemicals in the brain and antidepressants. Medications that regulate serotonin and norepinephrine in the brain are available with very few side effects. All this is very safe. It is necessary to take treatment for a certain period of time. A person suffering from depression for the first time needs to take treatment for 9 months. After 9 months of treatment, the treatment can be stopped by gradually reducing the dose according to the doctor's instructions. Psychological treatment called cognitive behavior therapy is also very beneficial for this. Along with treatment, which includes medication and psychotherapy, some lifestyle adjustments are needed. For example, proper sleep, proper exercise, regular meals and maintaining healthy interpersonal relationships are also important to prevent depression. So always remember one thing, by getting treatment for depression as early as possible, depression can be completely reversed and thus suicides can be prevented.